ideal method of examining a pregnant woman. Physical examination of the pregnant woman. Like I said, you must stand on the right side of the woman. Never stand on the left side of the woman for examination. Always centralize yourself. Like now, I am standing in the middle of that woman, and it is the abdomen that is directly in front of me. The legs are that way, and the head is here. I stand and relax, open my legs, because I am not expected to move while doing examination. To move down or to move up. That's an ideal method of doing examination of the pregnant woman. I can only tilt like so to the head of the woman and come back. I can only tilt like this to the legs and come back. You are not expected to take steps 1, 2, 3, come to the head. That's why you see a lot of medical personnel do wrong. And then you see they move again to the legs, it's wrong. Please stand in the center, relax your legs, and when you are examining the head, they only see you tilt like this to the head of the woman, and then to the breast, and then to the abdomen, and you stand. And then you can move back. You see only the neck leg only slants like that. So you don't take steps. I hope that point is understood. Now, to do a physical examination of the woman, the woman has to be completely undressed but covered with 2 sheets. This is the reason why you have 2 bed sheets inside your tray. Even as student midwives, you will not enter the hospital for practical exam without a tray. And that tray also has 2 bed sheets. Are we there? You do not use those sheets to make bed, like some of you always answer and ridicule yourself, even in practical exams. No, you use those examinations, those 2 sheets, to screen the woman for her privacy. Because in the hospital, maintaining the privacy of your client is primordial. It is very important. Reason for which there are these 2 sheets. Why and how do we use 2 sheets? You will, first of all, open one. If you don't have a screen that the woman can pass and stand behind and undress, then you open one of the sheets. Actually open one of the sheets and block yourself. Take it up like this. You are not more seeing the woman. While you give the instruction, don't do this. Don't say, madam, remove your dress. Then why you carry up this material? It will be funny now. If you have to carry up like that, you are screening by yourself so that she knows that you are not seeing her. Then you give her the instruction. She will remove her dresses all and lie down naked and you cover her. At no moment should you expose the nakedness of a woman in the name of antenatal examination. Are we there? When you now cover one, it will only take from her neck down to her vulva, just above the symphysis pubis here. Because the next sheet covers her now from symphysis pubis down to the leg. Don't expose her nakedness. One sheet covers from down right up to here, and the next one covers from up right up to here. Now see how I do the examination. I show the demonstration. I only go like this to the head, and if her head is well designed, clean, neat, I just need to thank her and then tell her to maintain this. If there's a problem, I take note of. And I'll look into the ears, I'll look into the nose, I'll look into the mouth, I'll look into, in fact, I will be able to palpate, touch around the neck to looking for what, because there could also be enlarged what? Thyroid gland. So you must also be able to do that palpation. Come down to the breast, only open the sheet, exposing only breast, not abdomen. Open the sheet on top of the breast. First of all, observe. Are they of the same sizes? Is the symmetry okay? Are they at the same level? That's what you take note of. When you take your hand to go and touch it, we call that palpation. If you only use your eyes to look, we call that inspection. Therefore, you have to inspect, you have to palpate. We are talking about the breast. When we come to abdomen, you will see that you also have to inspect. There are 3 main steps to examine the abdomen of the pregnant woman. And the steps are: 1, inspection. 2, palpation. 3, auscultation, which is what you use the stethoscope to be able to listen and count the number of, the heartbeat, okay, per minute and register. So, we shall come back to detailed examination of the breast, because examination of the breast is a whole procedure on its own, and they may ask you just to come to this woman and do examination of the breast. Briefly, what you are going to do is you will palpate the breast in a particular order. Imagine that the breast is divided into 4 halves each, but you palpate 5 areas. If you share the breast in 4 halves, you see that I have 1, 2, 3, 4. But starting from the nipple on top to press down to the chest wall and roll like you are drawing knot is the feet, the position that you palpate. Therefore, imagine the breast into 4 halves. Palpate. How do you palpate? The inner aspect of your palm. Close your palm like that. Everybody can show this. Straighten your palm very well, but close. Let there be no gap between your fingers. And straighten it very well. That is how you do palpation. And only this area, the inner aspect of the fingers, touches the abdomen or touches the woman. Your palm itself, the center of your palm, doesn't touch the abdomen of the woman. Now, that is how you palpate the breast. If you start from the side of the axillary region, the how do you call it, the armpit, you press the breast on the chest wall and roll in a circular manner. And go to the next part, roll in a circular manner. Go to the next part, roll in a circular manner. And the next, that's 4 rounds. Then come and put the last one, number 5, on top of the nipple and press down the chest wall and roll. If there is a nodule inside that breast, it will run between your fingers. And you feel it and note that there is a nodule there. That is also how you examine the breast of a woman for possible breast cancer. We will tell you that breast cancers will always originate or start with a nodule in the breast. And the earlier a woman knows that there's a nodule in her breast, the better. Are we there? That's the same thing you do with the other breast. But you note the color, the pigmentation, knowing that now that the woman is pregnant, the breast body needs to be what? It's going to be more pink, generally. But the area around the nipple becomes darker and even more darker than usual. That confirms that she is pregnant. That's also a sign of pregnancy. And then the breast is engorged. You see the breast really, as if it is swollen. No, it has only enlarged and it has only become more fresh, looking nice. Somebody may say, how nice that it will not look flabby like a woman who has already, who is not pregnant. Most of them, those that had babies before, that breastfed babies before, the breast, if she's not pregnant, the breast may be flabby. Now you cannot find that on a pregnant woman. They will firm. Are we there? Then you close the breast, then open the abdomen. You see now that I've opened the abdomen, but her privacy is still well covered because this next sheet must not be opened. That's why you're using two bed sheets. Now I've exposed the abdomen. First thing, inspect, please. Hold your hand like this, like a baby. Just look at the abdomen. What do you take note of on inspection? We learned that in class during theory. There are 6 elements you take note of on inspection. 1, the size, the shape of the abdomen. Number 3, presence of striatum, what we call stretch marks. Number 4, the presence of a linea nigra. There will be a dark line like that moving down. All of that confirms that she's pregnant. And again, what next? Number 5, presence of scar tissue. Maybe she has been operated upon. You see scar. Do you need to touch before you see scar? No. Number 6, which is number 6 element, you take note of inspection. Fetal movements. If the baby shakes inside the abdomen, and you see it as it tick like that, you don't need to touch before you see that baby is shaking inside the abdomen. Therefore, there are 6 elements you take note of on inspection. As soon as you just look at the abdomen like that, please, it's a blink of an eye. As you open the abdomen, you just see you go like that for 2-3 seconds. And then notice you tilt facing up. And your palm, the area you have to palpate in both hands, go to the left and to the right. At the fundus. You are struggling to find where the uterus, the level to which it has grown up to, or has developed up to. You know, the uterus, we say, grows in height. In with a very normal pregnancy, the uterus grows in height by approximately 1 centimeter per week. If you have not taken note of that, take note now. In a normal pregnancy, the womb of the woman is growing in height by approximately 1 centimeter per week. Reason for which, even if a woman doesn't remember when she got pregnant, you can put her down and palpate, you get the level to where the womb has grown up to. Measure the height, starting from the upper border of the cervix pubis up to where it has ended, up to the apex. If, for example, it is 30 centimeters, that pregnancy is approximately 30 weeks. Except in the case of twins, like multiple pregnancies, or a baby that is excessively large, what we call macrosomia, or a case of polyhydramnios where there's too much fluid in the womb, or a case of other abnormalities like growths. There could be fibroids in the womb plus pregnancy. Perhaps you will notice that the womb is not growing in the order it is supposed to be, or it could even be growing less, because there might also be what we call oligohydramnios, scanty amniotic fluid. The baby there may not be growing well. There may be what we call intrauterine growth restriction. There may even be more serious conditions that you cannot imagine. But that is how the mind of a midwife works when you are touching the abdomen of the woman. And now, when you now go to touch, please, to palpate, we tell you, palpate at the fundus, that's at the apex first, then by the sides, second, then you tilt, face this other way, and also take the same format to do the gentle pelvic palpation. When you do this, so you do a frontal palpation, you do a lateral palpation, and you do what? A gentle pelvic palpation. That is how you touch the abdomen. And that, as you are touching the abdomen, upon palpation, what do you take note of? There are also 6 elements you must record during palpation. 1, fundal height. Yes. Use your tape and measure what is the height of the uterus. That's why you record first. Fundal height. Second element will be what? The lie. How is the baby lying? The third will be what? Presentation. The fourth will be what? Position. The fifth will be what? Engagement. And after engagement, number 6 will be uterine contractions. As you touch the abdomen, does it contract? Are they contractions? So there are 6 elements you take note of on the inspection. You can sit up, you can carry a chair, sit down there. Yeah, you don't sit well. Okay. Now, please, when you finish with that palpation, the next step is what? Auscultation. And now you only get your fetoscope, and you take your fetoscope directly to the area you know that the fetal heart is going to be more prominent. What is that area? The area on the back of the baby closest to the head. Therefore, if you palpate it like that and the head is down here, and the lateral examination shows that the left side was smooth, hard, that is certainly the back. And if the head is down, it means that your fetoscope will go to the left side of the woman in the lower quadrant, knowing that that area is the back of the baby closer to the head. The heartbeat of the baby reflects that more than any other way. That's why you find a trained person who pick the fetoscope, go straight to that position, put your ear on it, remove your hand. Put your ear on it, remove your hand. Else, that fetoscope can notice even your own pulse from your own hands, and you confuse it with the heartbeat of the baby. So when you press it with your ear, remove your hand from it. You will get the heartbeat. Then you can use your watch and count. You can always hold the woman's hand at the pulse, radial pulse, for the woman. That's because you want to differentiate it from heartbeat. Else, you may be hearing but the woman's, the mother's heartbeat, not the baby's heartbeat. So make sure you put the hand on the pulse of the mother and completely confirm that it is different from, and that what you are counting is fetal heart rate. Now, please cover that abdomen and then go down to the lower part. You are not going to open her her vulva. In fact, don't even see her last. Don't open like this. How are you going to open it? Open from below. I just need to tilt like this, open it like so, and roll it, this other sheet, right to above her knees. And then I ask her to flex her knees. See, you bend it like so. You bend her knees like so. What I need to do to examine the vulva, I just open from the knee and send my eye like so, and watch the vulva, and close her legs, and straighten her legs again. Then I send my hands both to knee level, this area just by the side of the knee. Both sides, I hold at once and press. What am I looking for now? Edema. Edema, is there any swelling? Just press here once, go to the center of the tibia. At the center, press once, go down to the ankle, press once, and then on top of the dorsal surface, this upper surface of the feet, press again. And then you come back and stand in position. What you check that is edema. Then you cover the sheet back. Then you can dunk the woman. And then you can take this sheet like this. As you're rolling this one off, you're dragging this one down. You're rolling this one up, you're dragging this one down, cover her nakedness. Remove the sheet, bend it and tip. And then you hold it in the same way as you instruct her that as soon as I lift up this sheet, you can get up and wear your dress. See how I lift up the lift, covering with yourself. Say, madam, get up and dress. You hold it like this until she dresses. Clap for yourself.